Okay, so just recently, Dr. Peter Attia, and I've never met the man, I am actually a fan of some of his work, so I want to be clear this is not some controversial trying to attack his point, put out a pretty interesting article talking about GLP-1 agonists, and it's titled, and I'll link it below so you can read it for yourself, Lean Mass Loss on GLP-1 Receptor Agonists, a Downside of the Miracle Drugs. And I do think that this drug class is getting a lot of credit for being very successful at weight loss. There are probably more, I'm assuming, will be potentially more FDA approvals coming. There are already arguments within the medical universe, within the patient universe, if the lack of supply for those who need these medications for diabetes is being impacted by those who are trying to get it for obesity, as well as at what point are those who are trying to start using this medication to deal with starting it from just an overweight classification or even from a normal weight classification, just trying to lose a few more pounds, if that is medically appropriate or even ethical in the argument of taking away some of the supply from those who need it for obesity or for diabetes. Lots of interesting questions there, but we're going to focus on the question of, well, how do you classify and how do you ensure that the amount of weight being lost is effective weight loss? Because not all weight loss is necessarily great, because you're trying to focus on maintaining as much muscular mass as possible and getting rid of the fat mass that you have, right? So maintaining that muscle mass in the weight loss, this is the topic that he's talking about. And one of the criticisms he brings up, I think very valid, and something I literally didn't even know, is that only X% of people in these studies are recommended by the FDA to be tracked for body composition, as opposed to literally just weight and complications and things of that sort. And I think that if you're looking at somebody who's potentially losing, and some of these drugs are talking in the range of 10 to 15 to 20% body weight loss, body fat or body weight loss over the course of a year. If you're talking about losing 20% of your weight, for me, that could be over 40 pounds, right? I'm 208 pounds as of yesterday. That's a significant amount of weight. And if I assume that I'm gonna lose 40 pounds of weight loss and not have any muscular mass weight loss, I would find that to be an unreasonable expectation. But you want to try and mitigate that weight loss as much as possible. And so one of the things that is brought up is the notion that focusing on resistance weight training, focusing on maintaining your protein intake is a really big part of that. If all we do is take these medications and therefore reduce our hunger cues and reduce our weight loss, reduce our food intake to the point where we're not maintaining that muscular mass as much as possible, we could be causing some problems. And one of the points he points out at the end is specifically if we are already if we start using this as medication to just, hey, I want to lose an extra 5 pounds, but my weight classification is already essentially normal and healthy, are we risking taking people who are already a normal, healthy weight and in a quest to maybe look a little bit better for swimsuit season, or to lose a couple extra pounds to fit into a pair of pants or something that they have, that we end up having them drop muscle mass and therefore maybe cause them some problems? That's a reasonable question to ask. So one of the things I want to point out specifically, if you are chasing this, or if you're somebody who is just getting this medication randomly from an app or from someone who's not trying to help you monitor this and do it appropriately, it is important to consider body composition. It is important to consider, how do you mitigate muscular mass loss? How do you keep that muscle mass and make sure that you're doing it right? Now, another thing that he pointed out, and I think this is another interesting point, I'm probably gonna do a whole video again on this in the future, is what about those who already are at what we would call sarcopenic obesity? And these are people who, whether or not their total body weight places them in a class of obesity or a class of overweight, their body fat percentage, because they have such low muscle mass, their body fat percentage would place them in a classification of obesity or overweight by fat percentage and not by total weight standing on a scale. And I think one of the classics for this is, I'm sure we've all have usually an elderly relative who they just don't have the same muscular capacity, the same sturdiness, the same ability to get up and move around and do things, and strength that they used to. They've got a lot of muscle loss, but if you look at their actual weight standing on a scale, they technically classify as a normal weight, but they are so, from a muscular standpoint, incapable of doing all the things someone of normal weight should be able to do, that they still technically classify as too much of their body weight is adipose tissue. So they are a normal weight but technically obese by classification of body fat percentage. And that's a thing that we really want to try and avoid, because there is more to the health of obesity than the actual just weight on the scale. It's kind of a complicated thing. Leave your questions below. If you got some comments you want to make, I'd be happy to discuss through them with you. And thanks to Dr. Peter Attia for bringing this up. I think it was a pretty reasonable concept and something that we need to pay attention to in the future, because I don't think these drugs are likely to be going away anytime soon. And we got to think through all of the potential consequences whenever we take a medicine. Have a nice day.